The speaker that we have with us today is Zach McLean. Zach did his undergraduate degree, which was a Bachelor of Science in Kinesiology at the University of Lethbridge in the specialization of kinesiology. He also completed 2 master's degrees here at the University of Calgary, one a Master of Kinesiology and a second a Master of Science. And for his Master of Science thesis, the topic was the impact of blood flow restriction and high intensity interval training on characteristics on psychophysiological determinants of exercise tolerance during HIIT exercise. And he's currently pursuing his PhD here also at the University of Calgary under the supervision of Dr. Matt Jordan, where he is going to be discussing the topic of his PhD thesis in his presentation today. And so when he's done his PhD, he's interested in beginning a career as a sports scientist in a professional sports setting. And when he's not at work or doing his research, he spends a lot of time doing outdoor activities like skiing and hiking. And he also likes to play some golf as well, which hopefully with the nicer weather, you can get out and do that. So thanks, Zach, and we're looking forward to your presentation.
Okay, thanks everybody. So like was mentioned, this talk essentially is part of a larger data collection that I'm doing as part of my PhD, but right now we're looking at holistic biopsychosocial approaches for sport injury risk reduction in university athletes. So I'm lucky to work with Dr. Matt Jordan as his PhD student, and this is our muscle strength and power lab, but it's part of a larger lab, the Integrative Neuromuscular Sport Performance Lab. And in this lab, we kind of oversee and diagnose athlete monitoring system that I'm going to talk a little bit about today and share some of our initial results about. But in this lab, I've kind of got the opportunity to pursue a few things that I'm personally interested in from a research standpoint. And kind of 2 main topics in that area, as from a personal standpoint, is that I'm interested in understanding and optimizing athletic performance, injury risk reduction, and then return to sport after injury. And these are broad topics, but we think that applying an athlete monitoring approach in this setting that uses statistical approaches that are appropriate for big data is an interesting concept. So especially in the concept, if you imagine an athlete monitoring system that's longitudinal and takes several athletes and tracks them frequently over time, this data set can become quite big. And this is a practical problem that we run across in the sport performance world, is that interpretation and analysis of this data to kind of find meaningful results can often be quite challenging. So this is one area that we're investigating a little bit further, but really as one holistic kind of overview point, and it relates to this topic well, is I'm looking at why choose an athlete monitoring approach over what's traditionally done, which is discrete time point testing. So athlete monitoring, of course, can be used in the context of performance, but oftentimes is researched in the context of sport injury prevention. And that's kind of the framework that I'll use to discuss athlete monitoring today. But in short, there's several sport injury etiology models that have been proposed, like this one down here on the right-hand side by Gavin in 2017. And this model builds off previous models like the dynamic and recursive systems model. And in short, what these models have in common is that they relate the application of workload or training load. So in other words, the amount of work that you do or the amount of stress imposed by training or gameplay to sport injury risk. So this kind of is a common vernacular in high performance sport or in sports media, is the concept of load monitoring. And it's based on this principle where too much load may be related to injury risk and vice versa. But kind of emerging evidence has argued against this point, and there's some conflicting evidence regarding a link between workload or training load and sport injury, and how strong this relationship is kind of under debate currently. So more recent literature has argued that the application of workload or training load is too far removed from sport injury to have a meaningful relationship, and there's likely some other factors that modulate this relationship and might be kind of more helpful in understanding. So that's led to a few gaps in the athlete monitoring world that we've tried to address in a review that we've recently wrote. Especially three main gaps, which is consideration for an integrative approach that considers biopsychosocial elements, not just training load as an example, but also psychological and social elements, holistic baseline preseason assessments, and then frequent and longitudinal monitoring of athletes. So rather than, like I mentioned before, discrete time point testing. So as a part of a great author group, Matt and I have recently got this paper accepted in the Journal of Strength and Conditioning Research, where we talk about this concept a little bit and then also propose this new sport injury etiology model. And this looks very nice, but I'll zoom in a little bit and make it a bit bigger for you and break it down a little bit. So to begin with, like I said, we're using sport injury as a framework for this model. So here you have a susceptible athlete. They are exposed to some sort of event. And in the context of, as an example, ACL injury, this might be a cutting or pivoting maneuver. But you can imagine over the course of all the different sport injuries there's many different mechanisms. And this is kind of applicable to all of them. There's some sort of injury mechanism, some sort of event, and this causes an injury. And then, like the previous models, we include that the application of workload, or in this case, more specifically, external work and internal work. So the external load that you are applied to or exposed to is just that, the work that you do. So in other words, maybe the distance ran during a soccer game or the amount of high speed distance that you run during that same soccer game. And then this causes an internal response. So psychophysiological response that could include increased perception of effort and also increase in heart rate responses as two examples, but the list goes on. And then what we do to kind of bridge this gap between training load and sport injury is we include the concept of fatigue. So from here, we look at fatigue from two different standpoints. One is a decrement in performance or performance fatigability, and also your perception of fatigue or perceived fatigability. And these factors together are modulated by your ability to recover from this exercise intervention. And this causes some sort of short and long-term adaptation potential. Ideally, of course, you follow this top loop, which is a positive training effect, where you return back to your training status, but with an increase in load tolerance. So you're able to handle the same amount of load better, or maybe more load with the same response. But oftentimes, this lower loop or a negative training effect is followed, and this kind of is a consequence of an imbalance between this middle bridge between load, fatigue, and recovery. So in other words, too much load causing a fatigue response that can't be recovered from adequately may lead to this bottom loop or some sort of other kind of modulation. So a decrease in training load obviously is a bad thing, and then we argue that at some point, if you follow this loop for long enough, then you become a susceptible athlete who's at an increased risk for sport injury. And we add in these tertiary elements, which I'll just touch on a couple of them quickly. On the far left-hand side, we argue at a baseline assessment level, you should consider the athlete's history, which is maybe rarely done. So we know that previous injury is the best predictor for future injury, but the exact reason why that is somewhat unknown. And from this perspective, we can categorize athletes into those who have been previously injured and those that haven't been. And I'll talk about this a little bit more in a few slides, but also it might be important to consider athletes who, kind of using this phrase as an example, who from a muscle strength and power perspective, look like they could have sustained an injury, even though they haven't. So they have reduced performance. And then over here, allostatic load. And we use this term allostatic load as an overarching umbrella term that considers essentially everything else that's going on in the athlete's life. This is in the university setting particularly interesting, as it includes stuff like academic load, social load, mental health loads, nutrition, sleep, so on and so forth. And the list goes on. But this allostatic load together modulates the athlete's response to the load that they experience from an internal perspective, but also subsequently the fatigue response, their ability to recover, and possibly can contribute to this negative training effect. or possibly a positive training effect, depends. So this is the framework of this model. But at a certain point, if athletes follow this negative training loop, they end up in the susceptible category where they maybe get injured, they've got injured, and then we can just apply this loop once again in an athlete monitoring context through the return to sport and return to performance lens. So an athlete gets injured and then they undergo a longitudinal training program that we often call rehab. And this rehab involves the exact same thing as typical training, because this is just a small version of what's over here on the left-hand side. It includes an application of an external workload, the rehab program, or the return to sport program, a subsequent internal response, a fatigue response, recovery, and hopefully a positive training load effect, although that may not always be the case. And then, as you can imagine, this allostatic load that the athlete experiences in this return to sport loop is probably substantially different than the one that they experience in typical training. So it might include things like academic load, but it also can include some psychological factors like fear, maybe a reduction in confidence, or maybe, like in some instances, relief as a result of getting injured and avoiding some sort of sport situation. So following this loop, positive adaptations hopefully happen, and then athletes are cleared at the appropriate time and then can enter in through the positive side where they have sufficient load tolerance to be re-exposed to the external load. However, determining when return to sport occurs is challenging. So oftentimes what likely happens is athletes are prematurely returned to sport and they have inadequate load tolerance, and this negative loop can be kind of perpetuated. And that may be a factor that leads to high re-injury rates, as an example, after something like an ACL injury. So then we've taken this framework and then adopted it into the dyno setting. And here, this is, I have an overview of some of the work that we're doing with dynos. I'll just bring your attention to the first block, which is establishing the athlete baseline. Like I mentioned, holistic athlete assessments at a preseason level is something that we think is important. So right now we have 270 athletes, or probably in the next year, it'll be more than that, but approximately 300 athletes from 6 different sports that are field and court sports that are high risk for lower body injuries. And they get these assessments. It includes assessment of mechanical asymmetries, muscle strength and power characteristics, change of direction mechanics, some introspective measures, and a medical evaluation. Our lab specifically just works in these areas, and that's the data that I will present a bit today. And then, although it's not related to the data I'll present today, I'll just quickly rip through the rest of this, which includes athletes after the baseline assessment coming in bi-weekly for abbreviated testing, muscle strength and power characteristics, as an example. Exit testing at the end of the season, where we reproduce this baseline and can maybe in the future evaluate differences that occur over the course of the season. And then inevitably at some point throughout this season, we experience injuries, and those athletes, whether those injuries are minor or major, go into this injury loop where they're cleared at some point after a recovery period by the ATs to return to health, which in other words is just return to testing for us. So they are cleared for the testing protocols that we do. And then we use a progressive criteria-based testing approach to then use a data-driven informed approach to return them to sport. So we work closely with the ATs, the sports medicine physicians, and the strength and conditioning coaches to, as a group, determine return to sport readiness. And then at which point they would return back into the monitoring system. And there's also opportunities for further testing, maybe a return to competition or return to at the return to performance time points. So using this data that we've kind of collected at the baseline time point, I'll share a little bit about this paper that we've just recently submitted to the American Journal of Sports Medicine. And the premise of this paper is, how do biological factors, in this case, mechanical muscle asymmetries, relate to introspective measures of perceived limb function in athletes? So to begin with, like I said, we looked at muscle or mechanical muscle asymmetries. And why this is an important or an interesting concept is that it's often done in rehab or even in athlete monitoring from a performance standpoint to identify to return to sport readiness, but also to identify athletes that are at a higher risk for injury. And this is a challenging concept because essentially what you do is you compare the two limbs to one another in some sort of task. And in the concept of sport injury, you'd compare the injured limb to some sort of benchmark. And oftentimes that benchmark is the other limb, the uninjured limb. So here in the red circle indicates this injured limb, and the orange circle indicates the contralateral limb, which is often used as the benchmark. However, the issue here is that we know, especially in the concept of ACL injury, but other injuries as well, is that detraining of the contralateral limb increases the symmetry between the two limbs, but not as a product of improved rehab, but simply as a product of reduced function of the contralateral limb. So possibly there could be better benchmarking options, and that might include using the preseason data from that athlete. In this case, you can compare the injured limb to what the athlete looked at the start of the season or prior to their injury. And this makes a lot of sense, and it seems like a good approach. It's highly individualized, but the limitation here is that oftentimes we don't have pre-injury data on athletes. As an example, if you are an athlete and you went to a physio clinic right now because you just tore your ACL, they would have no idea what your baseline is. So maybe this creates opportunities for the third group, which is comparing an injured athlete to a population-specific benchmark of control athletes. And this is kind of like, as a side note, another project that we're working on right now is identifying and characterizing what how we should establish that benchmark, how we should establish a population-specific benchmark. So you might hypothesize that we should have sex-specific or maybe sport-specific benchmarks. Right now, there's no literature to say that. So that's something that we are investigating, and also investigating what methods are appropriate for establishing those population-specific benchmarks. But for the purpose of the data that I'm going to present, C, the contralateral limb benchmark is the one that we've used because this is commonly done and also very easy to do. And then the last point here is that it's important to assess this across an envelope of function. This envelope of function term is essentially used to describe the force velocity profile, which we're all very familiar with, of course. And I'm just going to quickly highlight a couple of tests that we utilize to go across this envelope of function. So for example, maximum concentric power or high force production and slow velocities, we can measure quite well using loaded counter movement jumps. And that's a test that we've included in this data collection. So athletes perform loaded counter movement jumps with a load that's equal to 60 or 30% of their body mass. Then they do just body weight counter movement jumps, so a little bit faster, obviously less force production. And then we're producing a new test right now, which is repeat hop testing. And once again, even a little bit on the faster side of the force velocity profile. But we also get the opportunity with a pool leg press that we have in our lab to do maximum concentric and eccentric force production capabilities to assess these. So this leg press is an isokinetic leg press where the sled moves at a constant velocity, and the participant pushes against the plate on the leg press to produce as much force as they can. So they push as hard as they can, obviously concentrically, and then the sled moves down, and then they resist the sled to produce maximum eccentric force. So as you can imagine, this has distinct benefits over something like traditional 1RM testing, which is highly skill-based, but also probably very difficult or impossible to measure true maximum concentric and eccentric force production capabilities. So what we've done for the purpose of this study is that out of our pool of approximately 300 athletes, we've identified athletes that have not sustained an injury over the last 6 months, and a variety of other requirements as well. As an example, they haven't had a concussion in the last year. and half of which were females. And these, once again, are across all of these 6 high-risk sports that we've measured throughout the season. And just like I said, across that envelope of function, we have athletes do all of these different tests, both in a unilateral and a bilateral methodology. So starting here on the far left-hand side, after a standardized warm-up, they do counter movement jumping, single leg counter movement jumping, single leg repeated hopping, some loaded counter movement jump testing, like I said, at 30 and 60% of their body mass. And then they do maximum concentric and eccentric testing on that leg press that I just showed you. And then finally, they complete here the sport fitness index, which I'll just go into in a second. But prior to doing that, is just of note is that we have both unilateral and bilateral testing, as some recent literature has argued that maybe unilateral testing is a better way to differentiate or identify differences between the limbs. So we've included both of these tests in this protocol. So finally, they do the sport fitness index, like I said, which is right here. This sport fitness index was developed in 2017 by Gary Wilkerson and validated to predict strains and sprains in NCAA Division I athletes 1 month prospectively and 1 month, 1 year prospectively and 1 year retrospectively. And here you, I'll just talk about this survey as kind of in a general point, is that if you imagine as a team, everybody in this room is on a sports team, I ask you to click a button and I say, are you injured or are you not injured? And maybe some of you say, yep, I'm injured. I have a hamstring strain as an example. But most of you will say, no, I'm not injured. So if you're an athlete that says, no, I'm not injured, this really encompasses a wide range of outcomes. And you can think of many different options, but I'll give you a couple to kind of ponder a little bit. But this includes athletes that have a relatively minor injury history, but maybe poor rehab, and as a result have pain or dysfunction or lack confidence, as an example, in their ability to perform or move well. It also, on the other extreme, would encompass athletes with a relatively severe injury history, as an example, maybe an ACL injury, but they've experienced excellent rehab and are maybe stronger than they were before, can perform very well and feel confident and have no issues, no pain. And then a third option, which is important to consider because it's not just sport injury, but it's also people who may look like they're injured from a muscle strength and power perspective. And that includes maybe athletes who have had a poor training history, and it kind of includes a social element, which has been proposed recently in the literature in relation to ACL injury, and that's the influence of gender. So as an example, if females have reduced access to training facilities and quality strength conditioning coaches and quality training in general, maybe this causes them to have reduced function, but not as a result of injury, but as a result of a poor training background or low training age. So that person would, maybe they would say, yeah, I have some pain and dysfunction and I lack some confidence in these movement patterns, as an example. So even in a large group of athletes that say, no, I'm not injured, this is comes with a wide range of outcomes, and where we think that we should adopt a biopsychosocial approach to consider some of these psychosocial elements along with biological elements like pain to kind of characterize like, hey, how uninjured are you actually? And this is what this survey does. So this survey is short, we get good adherence with it, and it includes factors like I mentioned, muscle pain, but also negative life events and other things that have been related in this previous study to sport injury. So Wilkerson then, he identifies these cutoff points that increase your risk for injury relative to a perfect score out of 100. And we use the same cutoff points to then characterize our athletes. So we characterize athletes into good, fair, and poor groups. So this is based on their perception of their limb function. And then the point of the study is to investigate how these introspective measures relate to mechanical muscle function. So we look at asymmetries across that envelope of function from both a bilateral and a unilateral standpoint, and identify metrics that are related to perception of limb function. These three metrics, I'll just zoom in a little bit more. So the main finding of the study is that increased concentric asymmetries from body weight counter movement jumps, but also loaded counter movement jumps and concentric maximum voluntary contractions on our leg press together are the best predictors of perceived limb function group, and that no metrics that relate to eccentric strength or other single leg mechanical jump variables were included in this model. So in addition to limb symmetries, it seems like muscle strength would be an important factor to consider, and that's exactly what I was talking about before. So these athletes have some sort of asymmetry between the limbs, but you would ideally like to have symmetrical and strong athletes. And in this situation, in group C, we could have a scenario where you have a symmetrical but highly weak athlete, which obviously is undesirable as well. So we looked at, based on these perceived limb function groups, we then categorized their concentric, eccentric muscle strength along with their counter movement jump power, so their limb performance. And we found that maximum concentric strength was associated with reduced limb function. And the poor group obviously is much weaker here on the far left-hand side than the good and fair groups. And then also a trend towards, although not significant, that same pattern in the eccentric group. So it seems like from that perspective, muscle strength is an important additional consideration to include along with asymmetries in like a baseline preseason assessment standpoint. And then a second part of this study was to consider how these asymmetries may compare across different tasks. And this paper by Chris Bishop talks about this a little bit, and this is kind of the general theme that you find in the literature, is that oftentimes it's thought that asymmetries are highly task dependent. So as an example, bilateral and unilateral jump asymmetries should not be compared because the task is different, there's different constraints, and as a result, completely different outcomes. But nobody's looked at whether this depends on your perceived limb function or possibly, like I mentioned before, your injury history. So what we did is we took all of these different variables that I've just talked about, the same variables I showed that large graph of earlier. And all of these are different asymmetries. And then we plotted them against each other in a correlation matrix for those with good perceived limb function. And we found essentially exactly that, is that these are highly task dependent. So in the top left-hand corner, I'll just orientate you to this graph, is that dark colors are a high correlation and white or light colors are a low or no correlation. And these dark colors are highly correlated in the top of this figure, entirely based on the fact that they are essentially all the same movement. So these are counter movement jumps and loaded counter movement jumps that are very similar to one another. But when you compare counter movement jumps to something like maximum concentric or eccentric strength, repeat hop performance, or single leg counter movement jumps, there's essentially no relationship here. And what this is kind of like I said, it aligns well with the literature. And people think that it's possible that you just, it's like this task dependent nature of these movements kind of results in athletes preferring one limb dominance over another limb's dominance. But if you look at the poor perceived limb function group, you can right away notice that everything in this plot is a lot darker. And although not included in this figure, then we analyze statistically, like, is there more high correlations in the poor group in comparison to the good and fair groups, and found that it was. So here the correlation is higher in the bilateral jumping group or bilateral jumping area of this graph, but also a moderate correlation is found across essentially all of the variables, where, as you can imagine, if you have poor perceived limb function, or maybe as a result of an injury history, you might prefer to produce, I'd say produce performance, but whether that's strength or jump performance on one leg versus another. Okay, so the key takeaways from this study in general is that we provide evidence of an interplay between psychological and mechanical markers of neuromuscular function in university athletes, and identify that between limb asymmetry should be considered within the context of maximal muscle strength, so that we can identify symmetrical but weak athletes and apply interventions accordingly. And then lastly, we illustrate that athlete perception of limb function modulates the consistency of muscle strength asymmetries across commonly implemented tasks, whether that be unilateral tasks or bilateral tasks. And together, these three takeaways have, I would say, large implications for athlete monitoring, but also athlete baseline assessments, and understanding possibly injury risk or identifying athletes that need intervention. So thanks everybody for having me talk. And I just want to quickly thank everybody in my lab for all the help with everything they've done, the data collection. Of course, thank Matt for everything he's done and for keeping me around for as long as he has.
We'll open the floor for questions. So who would like to start us off? All right, Arash.
So, thank you for the presentation. It was great. My question was about this sport fitness index, and you mentioned that it was validated, and it looks like it's a key for this specific research. And I was just wondering how it was validated. And maybe you mentioned it, but I missed it.
Yeah, so that study, just in short, it's an interesting paper, but it had athletes fill out the sport fitness index and then validate it retrospectively. So as an example, do you have a lower sport fitness index score if you have been injured in the past 1 or 12 months, 1 year? And that's validated for like sprains and strains, so kind of pretty general. And then the second part of that study then validated prospectively as well, where if you have a lower sport fitness index score, are you more likely to get injured within the next year? And that's they used an area under the curve analysis to identify key cutoff points, and those cutoff points are what we use to differentiate our athlete groups.
So basically, the criterion for validation was whether or not the athlete was injured.
Has been injured in the past or would be injured in the future. There's like two different analyses in that paper.
Okay, I have a follow-up question with that. There's a lot of factors in your model. So how do you determine the relative weightings of each of them, like the mechanical versus the bio, like the psychosocial ones?
In this first model that I presented? Yeah, it's a difficult concept, and it's I can go back to that slide. Yeah, so it's difficult. Obviously, the appeal to some previous models is that they are simplistic, and you can kind of evaluate the weight of these concepts like very easily, because you say, okay, training load seems like it's important to sport injury. But what we need to argue is that this simplistic approach, although definitely beneficial in some instances, has done little to reduce sport injury or kind of improve our understanding of athlete monitoring in general. So more recent emerging evidence has argued the opposite of that. It says, let's adopt a highly complex system and use, if necessary, statistical approaches that are good at understanding complex problems, that are dynamic and nonlinear and all these different things. And we collect a vast amount of data, maybe like a machine learning approach is a good method that you can kind of follow up with from there. So I don't know if I have a specific answer for your question, but in general, I think that the complexity of the model is one of its benefits, although it's difficult to interpret, obviously.
So I guess a follow-up question to that, just totally theoretical, and your thing, like I'm just interested in your ideas. Do you think that at certain points in either like a macro training cycle or whether someone's injured or not, like some of these, the weightings of each of these factors might change, and some things might be more important change.
Yeah, of course. I think that in general, like I've always prioritized this middle section of the model. So I always would prioritize understanding the application of something like external load and the internal responses, and then the fatigue or the changes in muscle strength and power characteristics that occur as a result. And if you can quantify that section well and continuously, and like I said, frequently, then that probably provides you with a good base to understand the athlete's performance in general. And then there's opportunities, like you said later on, maybe just at a baseline and end of season standpoint, where you can include psychosocial measures as well. But there's a lot of value, I think, to including athlete introspective measures essentially as frequently as possible.
Yes, you missed the mark.
So when you compare the first figures, the strength between the limbs, the injured and non-injured, do you normalize the body weight?
For
Like,
the
because I saw that the strength was like in newton per kilogram, so you normalize the body weight.
Yeah.
Do you have a way, because the body weight is the same for both limbs, but do you have a way to look at the muscle volume, like using imaging techniques, so to have more like normalization to the muscle itself?
Yeah, it's something that we haven't looked at right now. That's a great idea. From a practical standpoint, like I said, we test like 300 athletes at the baseline standpoint, so it would be pretty difficult, I think. But I agree, like an interesting concept. From a practical standpoint, like a coach might ask, it doesn't matter how big someone's leg is if they produce the same amount of force or the same value of strength. But I agree, like an interesting concept. I don't know if it's if we can apply it, unfortunately.
You know, so do you know the morphology of the muscle changes between the injured limb and non-injured limb?
Yeah, so in
Angle.
Yeah, so in general, lots of literature has looked at this before, but yeah, like the morphology of the muscle does change. The morphology of both muscles of both limbs change after an injury. As an example, after an ACL injury, so the pennation angle, like you said, also the distribution of fiber types changes, and a lot of like neuromuscular properties of the muscle change as well. That's like exactly kind of the point that I was bringing up as to why it's important to consider from a detraining of the contralateral limb perspective.
Can you take biopsies?
It'd be cool. We can do it for sure, but it might be hard to convince many people to do it.
All right, Art.
I was just wondering, are there any measures of ACL strength, which I guess is, I mean, we're presuming that it's related to muscle strength, but like image ACL, and does that correlate with increasing muscle strength as someone rehabs, or maybe you could pull on ACL? Or
That's a good question. Maybe the guy sitting beside you might be the one to answer that one. But I think in general, you can look at like ACL cross-sectional area possibly. But I'm not exactly sure about kind of like a continuous imaging technique that can be used like throughout the rehab process, if that's what you're getting at.
I have a separate question, which is, it wasn't quite clear on what you were intending to say about concentric versus eccentric. So it sounds like you have a good relationship between concentric strength and their own perceived sense of how much they rehab. But are you saying that that's a better correlate than eccentric, or it's just that it's sufficient so you don't need eccentric?
Yeah, so we just didn't see a relationship between eccentric variables and perception of limb function. And there's probably quite a few reasons for that potentially. I don't think that's us saying that it might not be important. It probably is quite important. But the way that we test it might be, maybe as an example, too variable. And it's like a pretty novel movement strategy for a lot of people. Like if you think about the last time, or maybe the last several times that you've gone to the gym, you do some maximum lifts in the gym, probably you rarely, if ever, have done a truly maximum eccentric contraction, and especially not on that on our device, and not unilaterally as well. So we find that there is a learning effect, And that learning effect, we have good reliability from that test, but people are somewhat like unfamiliar with the test itself, which may be why we see like that variability in the eccentric side of things in general.
Yeah, I guess I would like to see a good relationship with the eccentric, just because, so subjectively, I have no information on this, but I feel like I could suspect a lot of injuries occur in some sort of eccentric action, like, cutting maneuver, or, basically something is forcing your limb to go a way that you weren't wanting it to go. So in that sense, I sort of feel like injurious things are eccentric, but also like in strength training, they make a big deal out of eccentric, right? So you have special days where they emphasize negative reps because they really help improve strength. So, do you have a take on, where injuries occur and that's.
Yeah, I think I agree with everything you said. I think that the eccentric portion of whatever you're looking at, as an example, a cutting maneuver, is probably critical to understanding injury during that cutting maneuver for sure. If you look at within the construct of what we evaluated, which is perception of limb function, like how do athletes perceive their limb function? That includes a lot of different factors, but I don't have any data to back this up, but my gut feeling would be that athletes kind of evaluate how they move on the court, in the field, and in the gym, and maybe that's just like a representation of something that's a little bit more on the concentric side of things. Like maybe they are more familiar with concentric movements. I agree that there tends to be a large emphasis on eccentric movements in training, but whether that happens at the university level here, I don't know. And I would argue that probably there's some room for improvement in those areas possibly.
All right. Brent, then Andrew. You want to? Okay, Brent, Andrew. Thanks.
Thanks, Zach. That's a great talk. There seems, I think this is a two-part question. So it seems to me like with these sort of conceptual models of sports-related injury, there seems to be like a lot more these days. People are putting an emphasis on these sort of psychosocial factors. I guess the first part of my question, why do you think that is? Well, why is it all of a sudden now we're starting to focus on these psychosocial factors, whereas previously those weren't necessarily a part of the injury model, so to speak?
I think like going through the literature, this often happens, and I find that this old study, or not old, but like less new studies that look at factors that are biopsychosocial factors, and then they link them to injury. So as like I said, nutrition or sleep. So do you sleep less and you have poor quality of sleep, then maybe you're at a higher risk of being injured. And this kind of link between like risk factor and sport injury, it happens all the time across different biopsychosocial measures. And that's a good start, but is rarely included in a model in a more complex way, if that makes sense.
No, it absolutely makes sense. And then so here's then my second part of the question. This is the skeptic. So let's say that you take your allostatic load metrics and you do measurements on 300 subjects, you longitudinally follow them. And at the end of the day, you find that the one thing that predicts those that get injured versus those that don't get injured is that those that got injured did worse on their midterm exams.
Sure.
What's the causal inference between that specific thing happening and them actually getting injured? Is it somehow influence the tissue quality? Does it influence the training load? Like how do those allostatic loads ultimately, influence injury?
Yeah, I'll answer in two parts. One is that the allostatic load itself is like a pretty general umbrella term, and it kind of is like a maybe not the correct word, but like a modulator of this training load fatigue relationship that we proposed. So in there, as an example, you go and you write all your midterms and you are very stressed and you're very tired, and then you go and you play your sport. Like maybe, and this is where like a gap in the literature kind of exists, but I'm just speculating. Maybe you are less engaged. Maybe your neuromuscular system from a central activation standpoint is reduced and your rate of force development is lower, and that increases your injury risk. But I think the more important question, and maybe I'll just kind of change your question slightly and say that maybe it's not about what you do on your midterm. And because you find that relationship, you say, oh, midterm exam is bad, that means you get injured. And you say, like, it doesn't really make much sense. What we should be looking at instead of risk factors are risk patterns. And that includes like, hey, you have a high allostatic load for whatever reason, exam periods, but it's high allostatic load combined with a disproportionate external to internal load response and a high fatigue response and poor recovery, and all these things combined are at a higher, this pattern can be a higher risk pattern for some people. But then for me, there's a totally different risk pattern that is kind of associated with some injuries as well. And I think that that's kind of what's been proposed in the literature more often, is that we start moving away from these kind of single or multivariable kind of associations and start moving to like more holistic and complex nonlinear relationships that frankly are very difficult to understand, but maybe it doesn't really matter if they're difficult to understand if we can apply the model and get some valuable output in terms of like actual interventions. Yeah, I don't know if that answered your question.
No, it does. I appreciate it. I realize how complex it is. I wonder what you think. Like, do you think if we had perfect ability to accuracy to quantify external load and the ability to know about perfect ability to quantify tissue quality and these types of metrics, would those allostatic load, would those risk factors go away? Like, is it providing us with information that influences the injury pathway that we theoretically should be able to measure it physically, but we just don't have the metrics to do that yet?
Yeah, I think that's an interesting concept.
Sleep is weird, for example. Like, that one doesn't make a lot of sense to me.
Okay, I agree with that.
It always comes up.
Yeah.
So there has to be something with it.
If there's a theoretical world where we can perfectly measure external load, internal load, and all these fatigue metrics all together, then I think that probably eliminates the need to consider something like allostatic load. If you can measure everything together, like the cognitive state and everything in this imaginative world. But right now, there's no valid measure of load in general, and our ability to measure fatigue is probably better than load, but it's highly complex. And I think we need to consider that allostatic load element, at least maybe not in every statistical model as an example, but at least conceptually, to kind of understand the complexity of this relationship. As of right now, even in this perfect world where we can measure everything exactly, then maybe conceptually we should still have that allostatic load involved in the model, just to understand that there is probably a relationship there between something like non-sport related stress and the stress that you experience during a training session.
My question was, for your eccentric loading, was it a fast loading or was it a slower loading?
Yeah, they're both done at 0.2 meters per second, which is relatively slow. Or I'd say, I don't know, it's pretty slow.
So do you think you'd get a different response if you did something faster? Because like you're probably having a whole lot of like multi-tendon work and telling the person to stop pushing.
Sure, yeah, there's definitely
quicker, you might get a higher force sooner.
Yeah,
bypass some of that initial response.
I would agree with that. Yeah, this leg press only exists in a couple of different institutions right now. So we have a lot to learn about that leg press, and it includes stuff like higher velocity work, especially in the eccentric side of things. I do think that I don't know about the result that we would get from that, but I do think that it's a very interesting area to look at, and probably quite important, especially from a muscle or from a sport injury standpoint.
Yeah, so I think from a sports perspective, when you experience the eccentric loading in a sport, it's not a slow
Yeah,
process. It
agreed.
happens in a very short time window.
Thank you. That was great. Just looking at this model, I was wondering how you see more like chronic type injuries, like tendinopathies or stress fractures, and how they fit in this framework, where there isn't like, oh, I did this and that was my inciting event and I got an injury. It's like this developed over time, and the injury is picked up by a medical professional. That's kind of the injury diagnosis.
Yeah, that's also a difficult question that we considered when we were making this model, but we did our best to kind of consider it in this blue and red box, where we have acute and chronic positive and negative adaptations. So like you said, not all sport injuries, or maybe not even most of them, are acute. Oftentimes they're chronic and occur over time. So in this situation where you're experiencing this negative loop over and over again, the output might not be an ACL tear, but it might be like patella tendinopathy as an example. And we'd still say like, maybe you just have to kind of add in your own interpretation of the lines within this model, but we'd still say that would be a susceptible athlete. And some sort of inciting event, whether it's a particularly high training load day or a hard practice or something like this, that inciting event is going to encourage that athlete to go see a physiotherapist. And then at that point, they're diagnosed as injured, I guess.
Let's assume you have finished your PhD. Let's assume the model works. Let's assume you worked in a center of high performance athletes. What is the next step?
These are a lot of assumptions, especially me finishing my PhD. But I agree that these are the you take this, and then in that situation, I would take this model. Probably at that point, I learned even more, and there might be more concepts involved in that model. And I would conduct some sort of widespread longitudinal data analysis on these athletes as part of an athlete monitoring system that includes, like I said, load monitoring, fatigue, and other important considerations like I've mentioned. And then kind of linking many of these questions back together, I think with a sufficient data set, and likely a massive data set, you can apply some sort of interesting machine learning technology that will categorize athletes into different risk categories based on these nonlinear and complex relationships. I think that's maybe the interesting application for this model, but there's lots of other ones too.
The goal is to have a system that allows you to categorize the athletes with respect to injury.
Yeah. I don't think that predicting injury is likely the goal, but what the goal is to categorize athletes that are a higher risk for sustaining injury, a lower risk for sustaining injury, and in different buckets that kind of support individualized and data-driven interventions to improve performance outcomes.
And you would do that for specific sport or for all sports?
Yeah, maybe you start with all. Maybe you start with one, and you work from there. I think you start with a sport that's probably one of the sports that we've included in this study, which is going to be a field or court sport. So maybe as an example, soccer. And injuries, lower body injuries are common, especially knee injuries, and you use that as the base model. But I'm sure you could find a different argument for a different sport as well.
So if you compare the probability that you succeed, soccer compared to running, which one do you think would probably be more successful?
Yeah, you can probably, running probably is more successful. It's a little bit less of a chaotic environment, and it's an individual sport that's kind of like I said, a little bit more controlled. So that's definitely a better option probably.
Now, in the whole discussion, you didn't use the word holistic.
Yeah, that's in the title. Yeah.
So
Yeah.
in the title it's there. What is holistic?
Yeah, here we use the term holistic to kind of describe this biopsychosocial approach that kind of includes factors that, like I mentioned before, all these factors in this model but also multiple sports and male and female athletes and all these things together.
And would holistic include everything?
Yeah, I would say so.
Like you don't have it.
Maybe I need to change the title.
All right. Benno, all good? Okay, we'll go, Andrew was first, and then Jane. Or do you have Jane? Sorry. Joan, do you have a follow-up question for Benno?
In a way, I'm picking up on the point he said.
Perfect, yeah, we'll go with you first, then Andy. Easy.
Me?
Yep.
Yes, me. When I look at your model, I applaud your attempt to really have a very thorough review and include everything. But when you were looking at all these papers, did you find that some coaches and coaching staffs end up with a lot more injured athletes than others?
Yeah, and that's this is kind of reflected in this little bubble up here, whereas we included coaching practices and attitudes. So maybe you could include that as like more of a factor that influences the whole model. But in our case, we, for the purposes of this review, included it to affect external load. So like you said, maybe as an example, some coaches are maybe more of a volume-based approach, and they use lots of repeated actions over the course, over and over again. And maybe they do or don't care that athletes are experiencing some sort of minor injuries, and athletes as a result do or don't participate in that continued exposure to external load. Or maybe on the other hand, we have more of like maybe what I would call a modern or informed coach who understands this relationship a little bit better and is integrated well with sports science and sports medicine staff, and they modulate the loads and that athletes experience based on an athlete monitoring system, as an example. So we did consider it through the attitudes and practices aspect.
But did you ask the athletes, or find papers that ask the athletes if their psychological readiness to go back and work with that coach and that coaching staff who's really one of a very stressful relationship?
Yeah, that wasn't.
And is that an impediment to their recovery? Do you know of anyone that's looked at that issue?
I don't have a paper off the top of my head, although I'm sure somebody has looked at that in the past. It's not something that we included in this review. The main focus of this review is to look at the relationship between training load fatigue and MSK injury, and then we included this biopsychosocial approach in a second kind of like aspect of it. But I agree that that's an interesting concept, and I'm not familiar with a paper off the top of my head that's looked at it, but if it's not done, then it probably should be.
Sometimes, when you're looking for a PhD topic, it's always good to go where people haven't gone.
Yeah, that's right too.
Andy, so I got a question.
Yeah, sure. So more on the technical side of things. So you're trying to predict injuries, and you have all these measures. One issue I had when you had your correlation matrices is that many or most of these measures, for example, you count movement jumps at 60 to 30, like almost perfectly correlated.
Yeah.
That's kind of the enemy of trying to predict something, right? Because if we're capturing two information sources that are perfectly correlated, we haven't learned anything by capturing the second one.
Yeah.
So, you've got a lot of correlations going on here. I'm assuming these allostatic loads are probably also correlated to counter movement jump capacity or strength capacity, et cetera, et cetera. How do you sort of battle that? Okay, we want to capture the whole picture, but almost all of these measures are going to be highly correlated.
Yeah, I agree. That's a concept that Matt and I have been talking about quite a bit, and kind of in relation to some of the future projects that we have planned. And we don't have a solution yet, so probably then I'll come knocking on your office door. But yeah, it's a challenge in general. It's that some of these metrics, like we just used asymmetries in this paper, but there's several others, or maybe like 30 or 40 or 50 other metrics that we can get from counter movement jumps. And in some cases, they are distinct measures, I would say, or not highly correlated. In other instances, they are highly correlated. And we think that from a mechanical muscle function standpoint, they probably are different and might need to be considered differently. but it's a challenge and something that we need to consider a little bit more.
Okay. Lee, Venus, and then Ashton.
Thanks, Zach. I really enjoyed your talk. I just want to ask a couple questions about the Dino study because I'm curious learning more from a logistics perspective. These are a lot of athletes. It looks like they're coming in every couple of weeks. Like, are you testing them? How long does testing take? What was buy-in like from the coaches? Was it a really easy sell? And then last, I'm assuming that you've actually had some injuries now. So have you been able to do use any of that baseline data to look at recovery?
Yeah, so we, like you said, we had 270 athletes last year. I oversaw all of the baseline testing, but we have a lot of other master's students and honors students and undergrads that help in our lab as well. And then that's kind of provided them with the opportunity to help with the bi-weekly testing as well. So each student tester, we say, oversees one team, and it's their responsibility to test them bi-weekly. And then I just oversee that process. We do have several injuries that have occurred, but this is only year one of our data collection. I think that probably that question can be answered maybe in 2 or 3 years when we have, even though it's a big data set, we have a substantially bigger data set and maybe a little bit more, I don't know, for lack of a better term, statistical power to analyze something like injury or ACL injury specifically.
Yes.
So I understand that you want to like suggest a model or to suggest interventions in movement. But I'm thinking, and to try to isolate the allostatic load and the effect of failing an exam on the performance, are there any animal models of injury? And then follow up afterwards how the tissue recovers and then how the performance, like I'm sure there are like performance tests in animals. And so just to try to keep the kind of social allostatic loads minimal and then see the other ones.
Yeah, that's super interesting. To be honest, I'm familiar with the animal models that are associated with these kind of like more complex sport injury models. That's something that I haven't looked at a whole lot, but I think that's an interesting concept. Maybe you can kind of control that situation, control the environment a little bit more and create a closed loop system a little bit more feasibly, but it's something I haven't looked at.
I have seen a lot of these injury prediction model studies and yours as well, including the asymmetry index as one of the variables to predict injury risk. Is it established that asymmetry is always bad and that it will lead to injuries? Can it ever be protected, considering that a lot of these injured athletes do have this asymmetry? Can it be good in some cases and we're trying to get rid of it completely?
I'd say we don't understand sport injury well in general. To say that anything is good or bad is probably a little bit of an overstep. But yeah, I agree with your main principle is that maybe symmetrical or being asymmetrical maybe is not necessarily a bad thing. As an example, asymmetrical athletes probably occur in sport specific contexts, like limb dominant athletes as an example. If you're looking at like the basic understanding currently is that you would like to have, from an injury prevention or injury recovery standpoint, more specifically, you'd like to have strong and symmetrical athletes, which conceptually makes sense on kind of a broad scale. And that kind of leads into the point that I talked about earlier about establishing baseline markers. Maybe in the instances of athletes that are highly sport specific, and as an example, there could be others, and do have asymmetrical patterns, we might establish benchmarks that are specifically for those athletes, or maybe actually asymmetries doesn't really matter all that much at all. And it's other metrics that are better at differentiating athletes at the baseline time point.
Yeah, because I was just like thinking, maybe there's someone that's asymmetrical because they're, compensating for some sort of anatomical, predisposition. And so
Sure.
We're trying to make them symmetrical. Maybe we're actually introducing it. So it would be interesting to sort of compare your final results in injury cases to what your benchmark baseline measures were to see if maybe the deviation is more indicative of, if they went from being really asymmetrical to symmetrical and we got injured.
Yeah, exactly. Yeah.
Okay. answers build onto this?
Yeah, I know. Why should someone else have it?
Yeah, I'm just trying to figure it out. You go first, then Colin, then Benno will wrap things up for us.
Okay.
Yes. You and Benno can make the last question.
I'll try to keep mine quick. I was gonna make a really brief comment to say that when we were doing this scoping review, we originally were trying to string together training load, fatigue, and injury, and we started digging into it. And this is to Brent's point, everything is so fragmented. It's like one study looks at one piece and says, we missed all these things, we wish we'd done it. Another study looks at this piece and they say, we wish we'd done that. And so when we were starting to stitch this all together, we realized that in the context of a university athlete, it frequently comes up that there's all these other things outside of the training load fatigue piece. And when we formulated this, I think we formulated this as a bit of a, not a question, but putting the things on the map that shows up in the literature. And I don't know that Zach and I have really solidified any thinking about where the causal connections are, although maybe we have some ideas. So they've been really good points I think they've been raised. But can I ask you just one question, Zach? If you go to your, flip to your asymmetry one, the concentric one, where you were talking about the good perceived limb function, the bear and the poor, yeah. So what I thought was really interesting about this, that kind of builds off what Brent said as well. So these are non-injured athletes. They're athletes that if you ask them, are you injured? They say no. But then you ask them more detail about how they're doing and you realize, oh, you've got a whole bunch of symptomatology that looks like somebody who could be hurt. And in Wilkerson's study, he sees that if you use that tool in NCAA Division I athletes and follow them prospectively, you see this association between athletes who are in that blue group. They're the ones who go on to get hurt. But again, like to Brent's point, like what would be the causal mechanism that explains your perceived limb functions low, and then you go on to get hurt? Do you think that the fact that that group has higher asymmetry, they've got lower strength, does that make a potential mechanism that Ashna sort of raised? Like, does asymmetry and low strength contribute to injury risk? Is that a potential thing that we should explore?
Yeah, I think it's definitely something that we can explore for sure. In this study, we look at perception of limb function, which we think is likely related to injury risk down the line, but it's not injury risk specifically. But I agree, that's probably the combination of maybe many things. But if we're identifying factors based on this study, if you have high asymmetry or a higher asymmetry in these concentric and specifically heavy concentric movements, and you also are weak, then this seems like, and kind of based on our conceptual understanding from a strength and conditioning standpoint, this matches up well. And we think that this is, at the very least, undesirable trait and possibly also an injury kind of risk pattern or an increased injury risk pattern.
Okay, Colin, Benno, Walter, then Art. A lot of questions. So
Yeah.
Is that Benno's question got me thinking about like implementing this, and at some point I feel like you're gonna have to tell the athlete that they might be in an at-risk group. I'm just curious what your thoughts are. You know, you have to vocalize that, the potential of a positive feedback loop of now the athlete thinks they're at risk, and then there's this allometric load that increases because of that.
I think we do this all the time, from like two ways. One is that you go to a physiotherapist and they tell you like, hey, you are at a risk for being injured and we need to do this stuff to help you out. So we do that all the time. I don't think that that's necessarily a negative experience, but also I have more of a strength conditioning background, and it's the same thing. We see athletes and you from maybe data or maybe from like more kind of other factors, you identify an athlete and say that this athlete, I think, could be at a higher risk for injury or maybe decreased performance, or maybe it's the same thing. And then you have some intervention for them. I think sometimes it's good. Like I said, physio tells you, hey, I think that we need to tweak some things here to help you perform better, reduce your risk of injury. Also, like I've said before, I'm not going to go and talk to an athlete and say, I think that you're at a high risk for injury, because right now we're not very good at predicting injury and probably we never will be. And the same thing as I'm going to say, like, you're not at a low risk for injury because injuries are unpredictable. It's the same kind of relationship. But what I will do is, based on the data and the knowledge that I have and I can acquire from this group of athletes, I might categorize athletes into people that I think that need more of a specific intervention, and then I apply that intervention. I don't necessarily need to go and verbalize to them that they are at a high risk for injury. I don't think that's particularly useful in that context. But what I can do is say, hey, let's do some stuff over here, and it's gonna help you perform better. And that's the goal for every athlete, I would argue, right? They want to perform better, and performing better is kind of like the same thing as just not being injured to a certain extent.
Do you think that methods used in artificial intelligence would help you to solve you from maybe better than the method you have now?
Yeah, I'm definitely not an expert in artificial intelligence or machine learning, but I do think that it's a very appealing area. Like I said, lots of the emerging literature out there kind of argues for this point, is that we adopt machine learning technologies or artificial intelligence that can consider lots of data. Obviously, that's important, but also the nonlinear relationships between data points and the recursive nature of sport injury, as an example, in general. So it's super appealing and super interesting, but I'm not an expert in that area, but I think that it's something that should be looked into further. Yeah, for my postdoc, yeah. And Matt doesn't want me that long. Yeah, that's right.
All right, Walter, and then Art.
I'm going to ask questions, but the good thing is I'm going to ask a question, but I'm going to answer it as well.
Oh, great. That's perfect.
So you don't have to do anything. Will you ever be able to eliminate or significantly reduce injuries in high performance athletes? No. Would you want to eliminate or significantly reduce injuries in athletes, in elite athletes? No. Why not? Imagine a hockey team, a soccer team, a basketball team that hasn't had injuries for the past 5 years. Are they going to win anything?
No.
No, exactly. Because high performance sport is to go psychologically, physiologically, biologically, mechanically, in many sports to the limit of your abilities. And if you invent a new running shoe that allows you to run 50 kilometers more per week without getting injured, then it's not that less people get injured, but more people will run 50 kilometers more. And I very firmly believe that elite sport without a certain amount of number of injuries, it's just not feasible.
I think that's
not if you want to win.
I think that's probably true, and I think it's more so like maybe reducing the risk of maybe unnecessary injuries that are occurring maybe without this like high performance and injury balance, or maximizing the opportunity to return to high performance after an injury. Maybe that's maybe the more specific application. But yeah, I agree in general.
So do you think there's a lot of injuries occurring like unnecessarily that you think could be prevented without affecting the performance? Like are people just do stupid things? Or?
It's a very hard question to answer, because like what that unnecessary level is difficult to understand. But maybe as an example, with more training, you can, maybe the different way to look at it is that maybe with more training or better training or data-informed training, you can boost performance and have the same injury rate. Maybe that's a better way to look at it, and which I would say is probably somewhat successful.
Yeah, my question is pretty simple. Why is that plot a box plot and not a regression?
Yeah, this is a question I anticipated. And it had a very practical reason that we looked at this, is essentially that 2 points is that one, the Wilkerson paper, it identifies cutoff points, and as a result, we identify categorical sport fitness index perceived limb function groups based on those cutoff points. So in that paper, as an example, having a sport fitness index of 90 versus 100 had no meaningful difference. So why why plot a regression analysis if like, there's maybe not differences at these like kind of similar value points. On the other hand, I understand the limitations of this approach is that there's a cutoff point between good and fair at 86. Doesn't matter if you're at 85. I don't know, but I'm sure both approaches could be acceptable. In this case, we want to be able to categorize athletes into these bins. So that's the reason why we adopted this approach.
I feel like that previous paper was a mistake.
Could have been.
Because you started with numbers. And so what you could do is do a regression. And if the regression turns out okay, then you can say, oh, well, just to make it easy to compare with somebody else, I'm going to do the same discrete bins. I've already established the relationship in a better way. And then look, when we do the discrete version, it also works out. But I think you get a clearer picture and less investigator interference if you don't do the binning.
Yeah, that's a fair approach. I think, yeah, that definitely would work. I think both approaches are appropriate.
Well, one approach is better.
I think this approach is better because that's what we did.